Once your medical team is satisfied that you've recovered from your surgery enough to move on from the intensive care or high dependency unit, your next step will be to one of our ward areas, where you'll continue your recovery. The ward environment is likely to feel quite different from intensive care or high dependency unit. There are fewer nurses here, and if you're still receiving cardiac monitoring, this will be from a small box monitored from our central station rather than having a screen by your bed. You can be reassured that you will still be carefully monitored, however, and will only be transferred to the ward when your doctors are satisfied that you are ready. We will continue to assess your observations, for example your heart rate, blood pressure and oxygen levels, plus any blood tests or relevant scans. You may still have some of your lines in from your operation. These may include a temporary pacemaker, small drain, a large cannula and possibly a urinary catheter. We review these daily and aim to remove them as soon as safely possible. Your monitor will also be removed once it's safe to do so. This will often be when all your lines have come out. We will also review your medications and adjust them as necessary. Once you're on the ward, there will be a few changes to how we communicate with your nominated person or next of kin. We will no longer contact your nominated person daily, but they can telephone for updates as regularly as they would like. We can arrange for you and your family to meet with your medical team, so please ask us about this if required. Visiting times can vary, so please confirm this with the ward you're on. If you require different visiting times, please talk to one of the senior nurses on the ward.
On the ward, you will be reviewed by your medical team daily, usually in the morning. Your team will include a surgeon, either consultant or registrar, a junior doctor, and a member of the cardiac advanced clinical practitioner team. ACPs are senior healthcare professionals who have developed the skills and knowledge gained from additional medical qualifications to allow them to take on expanded roles of practice. Your medical team will work with you to come towards a plan of care to help you move towards the next steps in your recovery. You will need to complete the following steps before you can leave the hospital. All of your surgical lines will need to be removed, and your medical team must be satisfied with the following: that there are no outstanding medical concerns, that they are happy with blood tests and other investigations, for example chest x-ray, transthoracic echo, and that any other scans are satisfactory. Then you will be ready to leave our care. You will be eating and drinking normally and experiencing normal bowel function. You will also have been discharged from the therapy service. Your surgical wounds will be checked and your team will be satisfied with how they are healing.
The therapy team will play an important role in ensuring your discharge from the hospital runs smoothly. In most cases, the therapy team will continue to see you on the ward until you are ready to be discharged from the service. Though a small number of cases, patients may be discharged from the therapy service while still on the high dependency unit. How long it will take for you to be discharged from therapy service will vary from person to person, as everyone is different. We will ask you about your level of mobility before your operation, your home environment and your support network. We will discuss mindful movement following surgery and help to problem solve any difficulties you may have with this. We'll assess that you can safely get in and out of bed, on and off a chair and the toilet. The assessment may include practicing the stairs, however this is not routine and usually isn't required. We will also assist you to mobilise or move around the ward area and ensure that you feel safe in doing this once you get home. The distance expected will vary on your ability before your operation, and with practice and the assistance of our team, the majority of patients do not require any new walking aids, care packages or rehab following their cardiac surgery. Our aim is to ensure that you're ready to be safely discharged to your own home while you continue your recovery. If you have any questions or concerns about any aspect of this, please discuss with the therapy team at the earliest opportunity.
Whilst on the ward, we expect you to engage with daily activities and exercise to enhance your recovery between visits. This includes upper and lower limb exercises, walking to the toilet when safe to do so, getting washed and dressed into your usual clothes. We recommend bringing in button-up tops and loose-fitting bottoms along with comfortable footwear. As your feet may be swollen after surgery, you may benefit from a looser fit. It is normal to feel tired after your surgery. However, sitting in your chair rather than lying in bed will benefit your recovery in many ways, including aiding your breathing, core strength, blood pressure, and digestion. You can start by sitting in the chair for each mealtime and build up from there. You may be short of breath after completing daily tasks, so please make sure you take regular breaks between activities and continue taking deep breaths, as we will demonstrate. especially whilst you are less mobile. It is important to continue mobilising and carrying out your exercises once you have been discharged from the hospital to build up your exercise tolerance and strength.
Before you can be discharged, you'll need to ensure a number of things are in place for you. You will need to have pre-arranged transport home, or raise it to us early if you don't. You will need some groceries or items to prepare simple meals in stock at home, and you'll need a key to get into your house. Once you're informed that you're medically fit to go home, your medical team will need to prepare your discharge summary and the pharmacy get your medication ready. This will take some time, and we may ask for you to wait in our discharge lounge while this is done. You may still have dressings, sutures and surgical stockings. Your nurse will give you instructions to follow regarding these. Please ask if you're unsure. Remember that you will still be recovering when you're at home. Please ensure that you follow any therapy advice given and engage in any additional support offered to you. We're always looking to improve our service, so if you have any helpful feedback at the end of your stay, please let us know. We look forward to welcoming you soon.
When you are discharged from hospital, you will receive a copy of your HMR. This is a document outlining everything which has happened to you during your stay, including the reason for your admission, your operation, details of your recovery, and the list of medications we want you to go home with. A copy of this gets sent to your GP. Your medications might be different to when you first came in. You will leave with a 28-day supply and should arrange a repeat prescription with your GP once you are back home. We may advise you to make an appointment with your GP in 1 to 2 weeks so they can perform a blood test and check your heart rate and blood pressure to make sure that you have been well since leaving the hospital. You will receive a follow-up appointment usually in 6 to 8 weeks to review your progress. If you live in Southampton, this will be the surgeon who performed your operation. If you live elsewhere, you will be seen by your local cardiologist.